everyone, Zoe here from Living with a Sleeve. Thanks for joining me this morning, where we're going to dig a little bit deeper into the difference between a bypass and a sleeve. What I will do, I guess, just wait a few minutes while people are logging on, but we're going to go through today a little bit of an overview about what a bypass is and what a sleeve is and what the difference is, but really focus on what it means from a practical point of view. So why you might end up having a bypass rather than a sleeve, and what that means to you on a day-to-day basis. Because obviously what surgery you choose is based on you, but it's also based on your surgeon and your medical history and what they think is the most appropriate surgery for you. Just while we're waiting for people to come on, a quick reminder that if you are thinking about surgery, you can purchase my book, The Ultimate Guide to Sleeve Gastrectomy. So it's really looking at getting you through the initial stages of the surgery, so the pre-op Optifast, the fluids, the purees, and then getting back onto solids again. And you can get that at livingwithasleeve.com in the shop or on Amazon. And if you'd like to sign up, I have a blog post every week, a question and answer that goes live in the forum on my website every week. And I'm always posting things up on Facebook, so if you'd like to follow or be in touch for a monthly newsletter, just a roundup of everything that's happened at Living with a Sleeve, you can go to livingwithasleeve.com and pop your email address in there and you'll be on the list, so you'll be up to date. And I promise I won't send too many emails. I know that can get annoying, so just once a month we'll send a monthly sort of roundup of everything that's been going on. So we've got a few on now, which is awesome. Thank you for joining me. Really just wanted to talk about bypasses and sleeves, because I often get asked, you know, why should I consider a bypass or why should I consider a sleeve, and what would be the best type of surgery for me. I guess it's important to understand firstly what the difference between a bypass and a sleeve is. The way I like to explain it to people is that with a bypass, we're kind of rearranging the gut a little bit. So what we're doing is we are getting rid of, like, re-plumbing so that the food doesn't go through the entire bit of the stomach anymore. It only goes through the very top of the stomach, and then it goes straight into a loop of the small intestine. So you miss out on absorbing some of the food that you would normally get when the food goes through the stomach and then the beginning of the small intestine, and instead food sort of pops back in a little bit further along the line. So you get, it's what we call a malabsorptive surgery, which means that you get the malabsorption of certain nutrients, which leads to greater weight loss when combined with the fact that you can't actually eat very much, so you can only fit in a small portion when you do eat your meals. The difference with a sleeve is that we're not rearranging anything. Really with a sleeve, we're just taking out sort of about 80 to 90% of the stomach, leaving you with about a cup size. So instead of going from like having a big sack, you end up with a little pipe, and that just means that you can fit in about a cup of food. So it also reduces your appetite, similar to the bypass. So I guess the similarities between the two in terms of the practical point of view are that you can eat about a cup of food, you have a minimized appetite in between your meals, and both surgeries result in good, robust weight loss. So if you're looking for a weight loss surgery that has good results in the long term, then you're looking towards now something either like a sleeve or a bypass. So we know that with a sleeve, people will they will lose about 60 to 70% of their excess weight, and more than 2 years in, it might be sort of up to like 50 to 60% of their excess weight. A bypass is a little bit more, so it's sort of 60 to 80% of your excess weight that you'll lose, but really similar results over the long term, so down to sort of 50 to 60% of your excess weight in the long term. So they really are pretty similar in terms of the results. There are a few differences. you get more malabsorption from the bypass, okay, which can mean that you end up with more risks of deficiencies later on. You do not absorb any B12 when you have a bypass, so as well as the normal supplements that you have to take every day, you also need a B12 injection every 3 months, because you don't get any of this special little thing called intrinsic factor, which helps the B12 absorb because we're not going through the stomach. Other things that are different, so bypass is technically reversible. Not many people end up having it reversed, but it is reversible, and the rest of the stomach stays inside. They don't take that stomach out, which is why they can reverse it. Whereas with the sleeve, it's not a reversible operation, because we take out the body of the stomach. With a bypass, again, down to the changing of the plumbing, there's a higher risk of the thing that we call dumping syndrome. So dumping syndrome is where you'll eat something sugary, and you will know about it within about half an hour. You will be sweaty, shaky, and have diarrhea. Okay, and the reason for that is because your small intestine isn't used to getting undigested carbs sort of plopped straight in there. With a sleeve, you don't tend to get as much dumping syndrome, although you can still have things like lactose intolerance. With a sleeve, because we haven't changed the plumbing, there's more time for that for the carbohydrates, the sugars to be digested. So it's more like a normal digestive system than with a bypass. So some people do get a bit of dumping with a sleeve, but it's more rare than it is with a bypass. A sleeve, in terms of the surgery itself, is slightly shorter than a bypass, which can mean that it lowers the risks that you get with anesthesia and surgery in general. But you know, both sleeve and bypass have a risk of a leak, which is the major complication, but it is very small. So you know, about 1% of patients with bypass and sleeve have a leak, the complication of the leak. So really the biggest differences are the supplements that you have to take every day, and your risk of food intolerances with the bypass is higher. So you need more supplements, and the risk of intolerances is higher, and there are things that often don't go down well, like sugary foods, but both the sleeve and the bypass, you can have intolerances to food, and often it is sugary foods or really oily, fatty foods. So it is kind of practically reasonably similar between the two surgeries. I guess the biggest things that will help you decide is obviously your surgeon. So they're the number one person. It will depend on what their skills are, what their preferences are, what they think will be most appropriate for you. Also your medical history. So one of the other risks of a sleeve that I didn't speak about was reflux. If you already have reflux, often that will be an indicator that a bypass is more appropriate for you than a sleeve. There's up to about 50% chance of developing reflux after a sleeve, and in those people that already have reflux, we kind of try and avoid that as best as we can and just go straight to a bypass. You don't get the reflux from a bypass just because of the anatomy of the surgery and the stomach. Other things that might determine which way you go is your size. So often if someone is much bigger, a surgeon might recommend a bypass rather than a sleeve because you have more weight to lose. And the other thing that might determine what surgery you have is whether or not you've had some other type of weight loss surgery. So bypass is often the number one choice for revisional surgery, which means redoing a weight loss surgery. So if you've already had a band or a sleeve, then often what the surgeon will recommend is that we go to a bypass rather than redoing a sleeve or doing a sleeve on somebody that's had a band first. So I hope that helps really to, I guess, just compare and contrast the two surgeries. I want to sum up, The biggest difference between the sleeve and the bypass from a surgical point of view is that the sleeve, we're not changing the plumbing, we're just reducing the volume of your stomach, whereas the bypass, we're kind of re-altering the plumbing of the gut a little bit. So you're more likely to get some nutritional deficiencies and some food intolerances with a bypass than you are with a sleeve. But with a sleeve, you're more likely to get reflux afterwards. Both of them are quite similar in terms of your eating habits after the surgery, so going for good quality food, eating about a cup, needing to eat slowly and chew your food really well, take your time. But because of the more malabsorption that you get with a bypass, you do need extra supplements compared to a sleeve. So there are people that will be more suitable for a bypass, and there will be people that will be more suitable for a sleeve, and part of that decision is you and what kind of risks and benefits you want to weigh up, and what you feel comfortable with as well. So have a chat with your surgeon, read as much as you can, have a talk with your dietitian, have a talk with your psychologist. I think that's the most important thing really, is just using your team to all together, like with your team, make the best decision that suits you in the long term. I hope that's been helpful. If you, as always, if you have questions or topics that you'd like me to cover, please just either comment below or shoot me a direct message on Facebook, or send me an email, zoe@zoewilsonnutrition.com, or you can post on the forum on livingwithasleeve.com, and on the forum you can post your question and I'll get back to you as soon as I can. If you'd like to read more about sleeve versus bypass, I wrote a blog post on it which I published on Monday, and I'll pop the link in the comments section of this video as well, so that you can find it really easily. There's also a really interesting website called Sleeve versus Bypass, and that sort of looks at your risk factors and takes into account your weight and suggests, you know, what might be the best surgery for you. So just if you're interested, I wouldn't use it, I would take it with a grain of salt, and obviously use your surgeon's opinion as the only sort of final robust opinion, but it can be fun to kind of have a look at it and see what it comes up with. So I'll post that in the comments section as well. Otherwise, thank you so much for joining me, and I'll be back on again next Wednesday morning. So please let me know what you'd like me to talk about. I want to make it as useful and helpful for you as possible. So if you have a burning question, just let me know and we can chat about it next week. All right, have a great day, guys. Bye.